My name is Daniel Jones-White, and I'm the Managing Director of gradSERU North America and the Research and Development Director of the gradSERU survey. In this presentation, I will highlight what I believe are the top 3 issues we learned about the graduate and professional student experience during the pandemic from the gradSERU COVID-19 short survey. This presentation is intended to provide those working in graduate education a look at what I believe to be the challenges for graduate and professional students reinforced by the pandemic. Before I get started, I would like to take a moment to give special thanks to the gradSERU research team, which includes Igor Chirikov, Krista Soria, and Bonnie Horgos, who contributed to the development of the results highlighted in this presentation. The gradSERU Consortium is a member-run, not-for-profit research consortium designed to reduce the complexities and costs of challenging, managing, and reporting large-scale survey data that make informal collaborations difficult. Specifically, our partners collaborate by developing relevant surveys of the research university experience, administering common surveys across institutions, sharing gradSERU benchmark data and best practices, and informing policy and academic conversations about the research university experience. The gradSERU survey is one of 2 different surveys currently offered by the gradSERU Consortium and was first introduced in 2017. Since 2019, nearly 20 North American public research institutions have participated in the survey administration. This column on the right indicates all of the partner institutions that have participated in gradSERU since 2019. This spring, we are administering the gradSERU survey at 15 of our partner institutions. The results in this presentation come from the gradSERU COVID-19 short survey, which was developed as an immediate response to the COVID-19 pandemic. This was an entirely new survey instrument developed by the gradSERU Consortium and its partners to help gather actionable information about the pandemic for our partner institutions. 10 of our partner institutions participated in our survey, which was administered between May and July of 2020. Institutional response rates varied from 13 to 41%, and in total we have unique responses from 17,527 graduate and professional students. To learn more about our sample, you can visit it online at z.umn.edu/gradSERU COVID-19 sample. Now on to our results. The first major finding from our survey is that COVID-19 both created new and exacerbated existing obstacles to completion for graduate and professional students. We observe this in 2 distinct ways. First, the rapid transition to remote courses, while necessary, was a significant challenge for graduate and professional students. According to our data, 67% of graduate and professional students indicated that they adapted well or very well to remote learning, suggesting that more than 1 in 3 students felt that their transition was not particularly successful. In fact, according to our data, 88% of graduate students reported at least one obstacle to successful transition to remote learning. The figure on the right reports the frequency each obstacle was reported by respondents. The most frequently reported obstacle to successful transition to remote learning was the lack of motivation for online learning at 55.7%. While it is difficult to disentangle the trauma we were all experiencing from the onset of the pandemic from a student's lack of associated motivation, it remains clear that students were not initially excited about the new modality of instruction. This is something that administrators may need to overcome if online instruction continues to be prioritized after the pandemic. Beyond motivation, students also reported a number of systemic concerns about the online learning modality that will need innovative solutions for online to remain a viable option. I will call your attention to 3 of these. First, 54% of graduate students indicated that lack of interaction with other graduate students was an obstacle, which speaks to that loss of human connection I'm sure we've all experienced as our lives have become more remote. Second, 43% reported lack of access to an appropriate study space as an obstacle, a result that obviously exacerbates existing inequities in our society. Third, almost 2 in 5 students reported that the online modality was simply not conducive to their learning styles. In my opinion, these represent significant critiques of the online instruction modality and will need to be addressed if institutions want to continue to offer online instruction at scale. In addition to asking about the challenges specifically associated with the rapid pivot to remote instruction, the second area our survey explored the potential impacts of the COVID-19 pandemic was in relation to students' perceptions about their ability to make satisfactory progress toward their degree. Again, lack of an appropriate study space was a significant impediment to progress, cited by more than half of respondents in our sample. 43% cited the inability to conduct research during the pandemic as interfering with their progress, while more than 1/3 noted challenges associated with the inability to attend professional conferences. As a result, it becomes readily apparent that the COVID-19 pandemic was hugely disruptive to graduate students' educational plans. This has obvious implications for graduate schools, as the educational trajectories of graduate students are likely to be prolonged, posing both enrollment and funding challenges in the future. According to our survey, as early as summer of 2020, nearly 1 in 5 respondents to our survey expected that the COVID-19 pandemic would delay their completion. This is especially pronounced among PhD students, where that number grew to 1 in 3. Coupled with an already heightened concern about lengthy completion times for PhD students in certain academic disciplines, it becomes apparent that the cost of the COVID-19 pandemic will likely continue to be paid for by graduate students for years to come. The second major finding of our study that I think is important to share is the tremendous impact the pandemic appears to have had on graduate student mental health. Specifically, the issue of graduate student anxiety and depression has been a central concern for the gradSERU survey since its inception in 2017. Since then, the gradSERU survey has included 2 validated measures of clinically significant anxiety and depression symptoms in our survey instrument. For the first is the Patient Health Questionnaire 2, or PHQ-2, and the second is the Generalized Anxiety Disorder 2, or GAD-2. Because we have asked about these items at 8 of our partner institutions in 2019, we have a relevant, if not perfect, benchmark to compare rates of clinically significant depression and anxiety before and during the pandemic. In this and the following charts, rates of major depressive disorder symptoms are presented in green, while generalized anxiety disorder symptoms are presented in blue. As you can see, rates of both clinically significant anxiety and clinically significant depression rose during the early months of the pandemic. Specifically, comparing the 2 green bars, you can see that 32% of respondents reported clinically significant depression symptoms in summer 2020, compared to 15% in spring 2019. In terms of generalized anxiety disorder, you can see that 39% of graduate students reported significant symptoms in summer 2020, compared to only 26% in 2019. Both of these represent significant increases in anxiety and depression rates over the previous year. What's more, rates of clinically significant major depressive disorder and generalized anxiety disorder symptoms were not equally or randomly distributed among survey respondents according to our survey, where we observe underserved and marginalized student populations being much more likely to report these symptoms than their peers. Specifically, graduate students from low-income backgrounds were more likely to report significant symptoms of depression and anxiety than their more affluent peer. We also observed that transgender and non-binary students reported higher rates of depression and anxiety symptoms than their cisgender peers, as did LGBTQ+ students compared to their heterosexual peers. We also observed an association between significant anxiety and depression symptoms with academic broad field. We don't have an immediate answer for why this might be. Nonetheless, the combination of these past 3 slides have 2 important implications for graduate schools. First, the rising rates of significant anxiety and depression among students appears robust and is likely to tax already stressed counseling services at many schools. More services and initiatives are likely to be needed, and there are probably no easy answers as to how they will be funded. Second, as new interventions are considered, specific attention needs to be paid to the need for inclusive services and service providers. Marginalized and underserved graduate students are disproportionately impacted by high rates of significant anxiety and depression symptoms, as are students in specific fields. I believe interventions that are designed to target impacted students and meet affected students where they are will be necessary to overcome this rising challenge. The third major finding I would like to highlight from our gradSERU COVID-19 short survey is the growing challenge for international students seeking advanced degrees in the United States. As we were developing the survey, one of the areas that we were interested in assessing was how the pandemic was impacting the international student experience. While most of our initial attention focused on more pragmatic concerns of international student experience, such as the ability to return home, adapting to new time zones, we were also curious if the pandemic was leading to increased instances of harassment directed at international students. To that end, the survey asked international students if they had experienced instances of intimidating, hostile, or offensive behaviors during the COVID-19 pandemic. From our survey, we observed that 14% of graduate and professional student respondents had indicated that they had experienced harassment, with the institutional range of harassment rates varying from 11 to 20%. When asked about the impact of this harassment, 3/4 of respondents indicated that they were growing more concerned with their personal safety, while half indicated that it was affecting their mental health. 1 in 5 international students suggested it interfered with their academic performance, while 1 in 10 indicated that it decreased the likelihood they would complete their current degree program. To say that these numbers are concerning is obviously an understatement. This map presents reported rates of harassment by country for all countries with more than 30 respondents on the gradSERU COVID-19 short survey. When segmented by country of origin, our survey results from summer 2020 highlight a trend that we have become increasingly aware and concerned about: the rising rates of anti-Asian racism and xenophobia. According to our survey results, graduate students from China, South Korea, Vietnam, and Japan reported the highest rates of harassment during the COVID-19 pandemic of all international students. This has immediate and obvious safety implications, as it is important that students feel safe and respected when studying on our campuses. Which brings me to the last major finding of our study that I think is important to share with you today. The 3 major issues that I laid out are big issues, challenging issues, concerning issues. So I felt the need to leave you with one additional bonus finding, a palate cleanser, so to speak. I believe that our institutions are up to the challenge of finding supportive solutions to these problems, given the will. Why do I think this? I only have to look at how graduate and professional students responded to the COVID-19 gradSERU short survey. When faced with the immense challenges of the pandemic, our institutions seem to find it within themselves to find workable solutions to seemingly unsolvable problems. And our survey results bear this out in a couple of different ways. First, when asked about how satisfied they were with their institution's response to the COVID-19 pandemic, 79% of graduate and professional students indicated that they were satisfied or very satisfied with the solutions that were implemented. Second, when asked if they had felt supported by their institutions during the pandemic, 77% of graduate students offered an affirmative answer. This suggests that not only were institutions able to find solutions, but that the solutions that they implemented left students feeling that they were being supported during a particularly challenging time. If we can continue to bring the same urgency, the same creative energy, the same sense of compassion and grace that we relied on during the pandemic to solve that problem, I am hopeful that we'll be able to overcome these new emerging challenges as well. Thank you. To learn more about the graduate and professional student experience during the COVID-19 pandemic, please review our policy briefs at cshe.berkeley.edu/CERU COVID survey reports. To learn more about the gradSERU survey, visit www.gradseru.org. Thank you for attending this presentation.